Refractory period. It is the period in which the muscle does not show any response to a stimulus. Normal refractory period of ventricle is around 250 to 300 milliseconds and that of atria is 150 milliseconds. A refractory period is of two types, absolute and relative. Absolute refractory period, where it is around 180 to 200 milliseconds. Absolute refractory period is the period during which the muscle does not show any response at all, whatever may be the strength of stimuli. During phases 0 to 2 and about half of phase 3, the cardiac muscle is in its absolute refractory period. Relative refractory period is for about 50 milliseconds. The relative refractory period is the period during which the muscle shows response if the strength of the stimulus is increased to maximum. It remains relatively refractory period until the phase 4. Significance of which is, since the absolute refractory period extends throughout the contraction period, the following cannot be produced in the cardiac muscle, that is the summation of contraction, tetanus and fatigue. So this diagram shows the action potential and the myocardial contraction, where you are showing absolute refractory period and a relative refractory period. In absolute refractory period, the second stimulus will not be able to produce any response, whereas during relative refractory period, the increased strength of stimuli sometimes can evoke action potential.